All right, so by now, all of you must have heard about short people problems. If you haven't, then basically if you see a short person, you can use them as an armrest. There's usually struggles getting to larger cabinets that are higher up. That's a short people problem. But have you heard of short finger problems? Hey guys, what is up? This is Hafsa Slayman and you're listening to Confessions of a Doctorholic. So, today we're going to talk about the first time I performed a rectal exam. You're probably wondering, did I hear this correctly? And yes, you have. It was on a mannequin, so don't freak out. Anyway, let's go back in time. So, before going to medical school, when people ask you, so what specialty are you thinking of? I sort of mentally crossed out gastroenterology. I was kind of like, I don't really feel like seeing or dealing with colonoscopies, assholes, or poop. I don't want to look at the color, I don't want to smell it, and I feel like my nose is quite sensitive, so, it made sense. Little did I know that I'd have to learn how to do a rectal exam anyway. Anyway, for intimate exams, you start with a mannequin. Can you imagine a student who's never seen a butt before saying, hey, I want to try a digital rectal exam on you for the first time ever? If you ever had that fear, rest assured that never happens. We practice 1,000,000 times at least on these mannequins. All right, so let's go through the basics. So you put on blue latex gloves, you put on some lube, and you start by inspecting the area. So you look at the area, you look at the surroundings. Is there anything that's sort of interesting? Does there seem to be a condition? And then use your finger, you push it in, you check the anal tone, then you check the walls. And the main aim of this exam is to feel the prostate. And it's like the first thing they do to check for prostate cancer. So when you're commenting on it, the prostates are meant to be symmetrical and as big as a walnut. Okay, here's the plot twist. My finger doesn't feel the entire walnut, so I don't actually know if it feels like a walnut or not. So really, do I actually know the size of a prostate? Anyway, so I've got a ruler here next to me because I want you guys to imagine this. So I'm measuring my finger right now, okay? It's about 4 centimeters long. If you don't have a ruler and you've had braces at some point in your life, and yep, some of us were not born with perfect teeth. Anyway, so those little bristles that you use to clean the gunk out that builds up between your braces? Yeah, so my finger is as long as that. And obviously, it's completely inappropriate to put one hand on the mannequin and shove your finger in. And needless to say, this whole process is a struggle for me. So, with these mannequins, when you order a bodycon dress off of a dodgy website and you get that one size fits all scenario, that's how I assume mannequins come. I don't think they're actual sizes. I've seen that on the inside where the prostates are supposed to be, there's actually different things that you can put in. So you can put in what it feels like to have prostate cancer, benign prostatic hyperplasia, so you can actually replace that. But in terms of the actual mannequin, you can't change it. So basically, for my entire life, if I ever try a mannequin, I can't fit my finger in them. Sure, it goes in, but it doesn't go in all the way. All right, so let's fast forward a year later. I was on my surgery placement. We had a legend of a surgeon. So he was our supervisor, and out of the blue, he sprung on us, okay, so you're gonna have to do a rectal exam as part of your surgery placement. And I believed him, all right? But then what I was thinking was, is the patient actually gonna say yes? As a medical student, I have practiced this 1,000,000 times on a mannequin, but I've got short stubby fingers. Does someone actually want me to perform a rectal exam on them? Anyway, so on one fine day, we had a patient with an enlarged prostate. So he had benign prostatic hyperplasia. It was giving him problems. So he couldn't really urinate comfortably. It was causing him pain. So he got this procedure called a TURP done. It's a mouthful. Like even saying TURP is a mouthful. So that stands for transurethral resection of the prostate. So basically this procedure is where they insert a device through the penis and they sort of shave off the prostate. And it's done when the patient's awake. I mean, okay, before anyone freaks out, they're numb waist down. So it's not painful in case someone's freaking out. So the surgery was done. It was successful, yay! And the patient still had the blue sheet over him. So during a surgery, they usually remove clothes and stuff so that there isn't any source of like contamination. And it's easier if the patient doesn't have clothes on to put on iodine and disinfect and all of that. So they just put a blue sheet over him to cover most of him. That's also like to respect the patient. And there's like 2 holes in the sheet, one for the penis and the other one for the rectum. Anyway, so the surgery was over, it's successful, and then during this moment, the surgeon and the patient, they turn to me and my partner, and they ask us who's performing it. Anyway, I'm just like dumbstruck for a moment, and I'm like, okay, wait, rectal exam. So the surgeon, he's like encouraging us to do it, and I kid you not, it's like probably like, you know when like mama birds, they sort of feed their bird and they sort of go like, oh, come on, go into the wild, spread your wings, fly away. That's how it felt. So I'm standing there next to my partner, and then we're trying to be professional. He whispers into my ear and he's like, listen, you're gonna start. And I'm just like, listen, you're a guy, this guy's a guy. You know all of these parts. How about you go first? Then he nudges me forward. So if you don't know me well, picture this in your head. On a good day, in flat-soled runners, I will probably slip on the pavement and crash into a wall. That's just a Hafsa moment. So naturally, I stumble forward. And the surgeon, he sounds super proud. He's like, Hafsa, so you've volunteered to start. So I turn back and I shoot daggers at my placement partner. Anyway, okay. I know the anatomy of the region, really. Like, it doesn't take a genius to figure that out. And to make matters easier, there's like literally one hole to put your finger in, right? So I chuck my glove on and I begin exploring. Now, I'll be completely honest with you. Like, with the mannequin, my finger would just like sort of slip in. So I struggled to find the butthole, and it felt like, I'm so sorry if this sounds funny, but like it felt like so much time has passed. Anyway, I'm just like feeling around. I'm like freaking out a little bit, and then I feel my finger dip in. And that's when the surgeon asked me, so Hafsa, what do you feel? And the first thing I had to do was like check the anal tone and all of that, and there was none. And I'm so glad the surgeon decides to say, and like, as you know, you're not going to feel an anal tone because he had an epidural, so he's not going to feel anything waist down. Okay, so it felt like he was psychic. I was grateful for that. And then he asks me, can you feel the prostate? So I pushed my finger deeply inside and I felt it. I don't know if I felt the full walnut, but I felt it. And compared to the mannequin, in case you were wondering, it was softer, it felt smooth, and basically that was it. It was successful. Alright, so ladies and gentlemen, that was it. That was my first time performing a digital rectal exam. So I'm curious to know, have you performed it? Or has someone performed it on you? Let me know, give me some feedback. How do I improve my digital rectal exam skills? And see you next time. Alright, so I went on Google and apparently prostates feel like plums. Okay, so I went to the supermarket and I bought these plums. And don't worry, I'm not in the supermarket anymore. I don't think I have the balls to do this in public. So I'm currently blindfolded and I've got 2 plums in one hand and I'm basically touching it with my finger. Yes, get the visual, a little bit weird, but that's exactly what a prostate feels like. So Professor Google is right again.